First, I'll just start off formally. So, welcome to Conversations in Health, Global to Local. Uh, oh, I got excellent. We have a terrific guest here tonight. Maria Gomez is a Georgetown alum, so we are very proud of you. An alum of our nursing school, so Abby. And I think you all know from the readings and from the preparatory briefing, she's had an extraordinary career. She has an extraordinary life, which we're going to hear more about. But I would say, in my life of working in federal health policy, when somebody asks you what is the model for a federally qualified health center, what is the model? What is a sort of best in class of a community health center in the United States? Mary's Center is almost always on the short list of the 2 or 3, and that's because of your vision. And this is not, and I'm not just saying that because she's here. I didn't even know. I knew what Mary's Center was. We had not met, but I'd seen their work over the years, and that reputation continues to this day. And apropos the title of our class, we've had a former ambassador talk about global health, and we're going to talk about very much local health here, but of course in a much broader context. But the very real experience of communities. And so, Maria, thank you for joining us.
Thank you.
So our tradition here is that we'll go around and ask each of the students to introduce themselves, the school that they're in, the program they're in, and where they're from. So you have a little context. Great. So as you know, we had 2 Maddies get you ready. So we'll start with one. So why don't you, Maddie, you want to start us off?
Hi, I'm Maddie. I'm from London. And I'm in the School of Health, majoring in global health.
Oh, wonderful. Great.
Hi, I'm Sylvie. I'm a freshman. I'm from Portland, Oregon, and I'm in the School of Health. I'm in China. I'm in the School of Health as a major in global health.
Nice.
Thanks. Hi, I'm Abby. I'm from New York, and I'm a sophomore in the School of Nursing.
Hi, I'm Alina. I'm from Northern Virginia, and I'm a junior in the School of Health studying global health.
Hi, I'm Ben. I'm from Chicago. I'm a sophomore in the college majoring in government.
Hi, I'm Arjun. I'm a sophomore from Pittsburgh, Pennsylvania. I'm studying healthcare management and policy in the School of Health.
Hi, my name is Gia, and I'm a senior in the SFS majoring in global health and international affairs, and I'm from Minnesota.
Hi, I'm Ryan. I'm from just outside Chicago, and I'm a freshman in the college studying biology.
Hi, I'm Colin. I'm a freshman in the college studying biology as well, and I'm from just outside Seattle.
Hello, I'm Lily. I'm from Arlington, Virginia, and I'm a freshman in the School of Health studying global health.
Hi, I'm Madeline. I'm from Chicago, and I'm a freshman in the School of Health studying human science.
That's great. A lot of people from Chicago.
I know. It's not just me, but I didn't cook it up this way. But no. Well, Maria, the one thing everyone here shares in common is we all went to Georgetown, so, and including you. But I guess, as I mentioned, the way we like to start this is to ask people to start at the beginning. And while coming here, I know was a key part of your life, I know that's not where the story starts. So I guess it would be great if you could take us back to Columbia and the experience you had coming here, and just kind of help every student here is trying to map out where they're going to go next. Right. And part of the goal for these conversations is to hear other people's stories and to share some of your thoughts about the journey along the way. So please.
So I hear that I don't have to move the microphone. You can hear okay? Everything good? So thank you, John. I guess I would just say I was born in Colombia, South America, and I came here when I was a teenager, about almost 13. And we came here for the same reason I think that a lot of immigrants that you hear about nowadays come. It was Colombia, as you probably all know and read and have heard about in many years, has been in civil war for many, many years, and was in a civil war through the whole time, from the moment I was literally born all the way to the moment I left. And the reason I left, it was very hard in Colombia for anyone who was not born into money to actually continue their educations beyond, primary school. And it was just really hard to live there in terms of the poverty, the hunger, the homelessness, the joblessness. My father was killed during that era, and so we were lucky enough to actually fly as opposed to cross the border. We flew with a family that actually lived in Arlington, Virginia, who actually worked for what used to be the name of you probably know this. What was prior to the CIA?
The OCS.
Yeah. So Mr. Brown, Kermit Brown, brought us here, brought my mom to care for their children, and so. But I think if I can go back a little bit more to Colombia, I think there was Colombia has and has always had a great educational system if you could afford to go. And so I was able and lucky to be able to go to schools because my mom befriended the right people for me to be able to go to really good schools. And so that was one thing that was always in the back of my mind, the education, the value of education, why education, because it made it, even though I didn't know English when I came here, the fact that I was an educated, almost 13-year-old, and in many ways far beyond the kids here, because school there is a little bit more advanced. So I was a little bit more advanced in the math and the science and those kinds of things, obviously not in English. And so what they did back when you came here was immerse you in the English language really quickly. And so within like literally 6 months, I was fully bilingual, because it was kind of like putting you in the deep side of the pool, either swim or sink. And so that was the experience. But I want to say that because I think as we have this conversation, John, the value of education it's been really something that was always in the back of my mind and what helped me think about what would Mary Center look like. But I think that I'll just end it by saying that all that tragedy and all that, I think of having to leave practically with nothing, but lucky in many ways that we came into somebody else's home and sort of kind of live with the family and sort of was able to be submerged, if I can say, in the culture of the United States. And I was just saying to him that in some parts of the world, the cultures are much more different, right? Much more different. And while English was not my primary language, the cultures weren't all that different, right? So I think that I would say that I was very lucky to actually get out when we did, and to get out safely and to come here to the United States and be supported with the supports that we got, and I got to learn really quickly by being in the moment of what it was that really helped human beings to kind of thrive. So I'll leave it at that.
Well, so you came here and you basically went to high school in the United States. Yes. And so how did you, think that you wanted to become a nurse? Mm-hmm. And how did you choose Georgetown?
So I wish I could say it was something really much more romantic or something, but actually I went to high school. I shouldn't say down the street because we're not in the main campus, but from the main campus, the school is now called Duke Ellington. In those days, it was called Western High School. So there was the Western High School was on this side of the city. Wilson High School was farther up north, and then there's Eastern High School. So the high schools in the city. So I still remember going to the school and being somewhat, still new to this country, and coming up against the disparities in the hardship of kids, African American kids that were being bused all the way from Southeast to Western High School, Duke Ellington, every morning. So they would arrive at 7:30 in the morning, and if any of you have ever driven over that way at 7:30, at that time in the morning, the rush hour is, they were on the bus for almost an hour and a half to get to school by 7:30. So I learned a lot about sort of, the tragedy of this country, right? Of slavery and all that through the mouth and the history and being invited to the homes of this kids. And so I was enriched by that, right? So when I was getting ready to graduate, it was just my mom and me, and she, it was very hard for her to actually learn English and to do all those things that take someone to another level, because she had to work really hard. Once we left the family, which was about 2 years after we got here, she had to work 12, sometimes even 2 shifts, or 16 hours a day to make ends meet. So, and every penny she earned was for rent and for food and for transportation and those kinds of things. And so going to college was not an option for my mom. That was like, you're going to college. And then I said, well, Mom, how are we going to pay for it? And she said, you figure it out, because we don't have any money, but you're going to college. So I think every high school, as you know, has colleges to come. I'm sure that's how you ended up here, right? They come in and they talk, and you go talk to the counselors from Georgetown, and wow, you went, yes, I want to go to Georgetown. Same thing happened. They just walked over to the high school, and Georgetown and Catholic, and who else was it at that time? I forget who else was. Notre Dame, and that's another school up in the Midwest, I forget. But anyway, we're really, really interested in me going to the school, and it came down to really who would give me the most money. I hate to say it, John.
No, that's
who would give me the most money?
Actually, I'm happy that Georgetown won.
So I have to tell you, even though it was like $6,000 a year. So imagine, I'm old. So think about what that was, right? Wouldn't you be happy if it was $6,000 a year? But $6,000 a year back then in the 70s was a lot of money, right? For somebody who was basically, she was a housekeeper, and she worked in hospitals. But she was earning literally, as you can imagine, half of what most people earn now for that. So there was some money, but that's how I ended up and I have to say that I had a great education here at what I say is Western High School, but Duke Ellington, but not as great education as probably many of you that come to the school have had in Chicago and in places where you're from, Minnesota. Just it wasn't advanced enough, and so catching up coming into the school was very, very hard, because everybody had taken APs, everybody had done a lot of there was a lot of work that they had done to get here. And so I think that experience in itself, John, I think for me was very eye-opening, right? In terms of who I was as a person, who I would want to become, and who I would want to reach out once I made it. So I made a promise for myself when I was your age that if I graduated from Georgetown, that I would reach out and give a helping hand to someone else. That wasn't possible right after graduating from here, because I had to work right away. And the nice thing about nursing, so I know one of you is going to nursing, but is that you can find a job anywhere, right? And nursing pays 10 times more than it paid when I was a nurse. But it was a very fulfilling experience. And I think that one thing that many of the fields that you're going into, that I heard you going into, is that they're broad enough, right? You're young enough and you're broad enough. And for me, nursing was broad enough, even though it was specific on how to take care of people. It was broad enough in terms of the whole world was opened. It opened up a whole world for me at the School of Nursing. In those days, as I wrote in the book, and it wasn't appropriate, but it was called the Georgetown University Nursing School. So the acronym was GUNS.
It was.
Right.
It was when I was here too.
So that was changed, thank God. But anyway, I still wrote that.
Thank you very much.
To remind you that
about our days, exactly.
Progress.
Well, let me. So just when you were, did you work in a hospital? Did you work in a clinic? Did you stay here in the D.C. area, or did you work outside?
So what ended up happening is I, as in the profession, it's always good to sort of make sure that you do a stint in the hospital just to kind of get, your bearings in terms of what it is to take care of people in a hospital setting, because you learn so much. And I moved around in different areas of the hospital, and then as I started to take care of patients in the hospital, I realized that so much of why men who were like in their 50s, there were a lot of men that were coming into the cardiac unit, and they were repeaters, heart attack repeaters. They would come in at 40, and a year and a half later they would come back again, and realizing that there was a lot of education that needed to be done. There was a lot of prevention that needed to take place in the community. A lot of things that we saw in the hospital were so unnecessarily not belonging in the hospital setting, and if they could have been taken care of earlier in a hospital, in a community setting, it would have been so much better. So that got my wheels turning about how to get out of the hospital setting. And hospitals are great, and if people who want to stay in hospitals and work the rest of their lives, hallelujah, we need you. I felt confined, right? And this is one thing that I say to all of you, not necessarily just in nursing. If you feel confined in your profession, begin to question, right? Begin to question, is this the right thing for you? If you're confined and it's not allowing you to think, to feel happy, to feel joy, to feel like you want to go to the next level, always question that and see if this is the right job for you. And hospitals just didn't make me feel happy. Every time I walked in after being in a hospital for 5 years, and my first stint was at Georgetown, it made me very sad, because I saw, I went through, the cancer unit with kids, and I went through, cardiac, and a lot of young men in their 40s and 50s died. A lot of young kids died, and there was a lot of death happening to women during birth at that time. A lot of kids who died, like literally like at birth or within a few days of birth at that time. So I needed to, I felt like there was so much that needed to be done in the community, especially on the prenatal side and on the cardiac side. So that got me out in thinking about what to do. And I started to look at who are the people that are like managing healthcare, and realized very quickly that it was the insurance companies, right? So I got working with an insurance company to do they had a 24-hour line where people would call in when they were sick, and that got me even my wheels turning more about preventive care and knowing how important that was. And then I worked for the American Nurses Association, actually going into people's homes to do care into people's homes. This is about the time when the hospitals were trying to discharge people very early. So like, you can't stay in a hospital more than a day for this, and 2 days for that, and 3 days for that. And they discharge people with IVs and all kinds of things. So I did a lot of care in the home, and that really taught me a lot about, obviously a lot more about healthcare and about some of the technology. I actually was very instrumental in talking to a lot of technology folks that were creating technologies in the hospitals about what was necessary in the homes for people, right? So I think for me that was very instrumental in also finding out like that healthcare, so much of healthcare is about not healthcare. It's about all these other things. It's about food. It's about housing. It's about the environment, about safety. And so that got me into public health.
Okay. And so now to paint a little picture of what Adams Morgan was like in the 1980s, when you began to think, and you and your colleagues started to think about Mary Center, was this when the threads came together? How did that start? How did you get started?
Yeah. So that's, I think, when my brain really started to click about like I could really pay it forward, right? This is about in the 80s, and so in the 80s, some of you may or may not know, depending on how much history you've taken, that this was about the war that happened in El Salvador, Nicaragua, all of Central America, Guatemala, and all that. Was a lot of distress. And some countries were supported by the United States, some countries were not supported by the United States for all the various political reasons. But there were a lot of people coming from Latin America because of what was going on, and the same thing, same reason I fled, except I flew. They crossed the river. And I was working, where was I working? Oh, I was working for the Department of Health in the District of Columbia. And I was one of the public health nurses in the District of Columbia, and began to see, because I was one of there were two of us who spoke Spanish at that time in the whole Department of Health that were at the front lines in the Department of Health. And so all the people that were coming into the city, and there were lots and lots of people coming into the city at that time in the 80s, very much like what's happening here. I feel like I did a 180 again from the 80s to the 2023 is same issue. But I saw so much tragedy, right? Every single person that we saw in the prenatal program at the Department of Health had been raped crossing the border. And most of the people that were traveling at that time were women, and kids your age and younger, 12, 13 years, just like what you're hearing in the news nowadays, because they were the only people that were not engaged in the war. And there were the people that were like, you got to get out to be able to send money back home, to be able to survive. And the men were caught up in the war. So many of the women were single. Many of the women that came here were not even married, and they were, as I say, single, came here to support their families back home. So being in that health department, I really found myself like, what can I do? What can we do differently to support families? And started to think about my trajectory, John, about what got me here. What were the things that were like the support systems, the assets that I had, the assets that my family had, and what were the barriers, right? That made it almost impossible for me to do certain things. And so I think that's how we brought together. And at that point, there was Healthcare for the Homeless, right, and Janelle Getches. And Janelle Getches was really working on making sure that she concentrated herself on the homeless. Right. And so the prenatal program, she wanted to offset that prenatal program somewhere else, and so I offered. That's where you stepped in, right? And that's where Hail Mary Center started, right? Mm-hmm. And so, as you all read that there's been 30 years of experience and evaluation, but I guess what's striking to me is, excuse me, we use the term social determinants of health today. Mm-hmm. I don't think that was a phrase used in 1988. Yeah. But it seems like the vision was there from the beginning, that you were going to take a holistic view of how care worked. And then, so I guess some thoughts. Did you find resistance to that vision at the beginning? Mm-hmm. And then also, how did you enlist people? Because it's obviously Mary Center has grown enormously since then. All right. So thank you, John, for that question. I think for me, again, doing through my trajectory, I think that what allowed me to really thrive was the support of family, the support of friends, the support of the community, in the sort of the idea that you can do it if you can have that village behind you, right? And so I think the Mary Center started with one. There was an urgency, right? The urgency of pregnant women coming in, and women that have suffered, if they weren't pregnant, had suffered a lot of tragedy at the border, whether it was hunger, whether it was heat, whether it was rape, you name it, they had it. The loss of an entire family that they lost, and the burden of having to. Their family borrowed thousands of dollars. Even in those days, they borrowed thousands of dollars to get that person here. And so they had to earn that money back so they could pay him back. Because if they didn't pay him back, somebody in the family would not be alive. I mean, that's the way it works. So I think as we started Mary Center, we started to realize that we could talk to people about how to take care of yourself during prenatal care, what good food to eat, what kinds of foods you should eat, and all those kinds of things that maybe we realized soon after the work that was, and I had done it in the Department of Health, but the model in the Department of Health was there was no time, right? You had to patients had to be put through every 15 minutes or less. But we had an opportunity to create something that was a little different. And so I think we realized soon thereafter that if we were going to really have some really good outcomes for their children and for the pregnant women, that we had to make sure that those social determinants of health were there. And all of you probably know, have you had a session on social? Okay, so I don't have to go through those, but right. So, but I think that the resistance came because even within the field of healthcare and even within government, people said, you can't do it all. There's no money to do it all. And, if Mary Center is called, because the original name was Mary Center for Maternal and Child Health, that was your vision, stick to your core and only do maternal and child health. And I kept saying to them, but you can't do maternal and child health without making sure that, if there's, hunger, that we take care of that. And we have to be able to do those relationships. Not that necessarily that Mary Center has to become a food bank, but that Mary Center has to have staff to make sure that we connect people to, and not only just give them a number, but actually connect them, because in those days, the food bank, they didn't speak Spanish, if they refer them to a hospital for a specialty care, nobody in the hospital was required to speak Spanish. And I mean, on and on and on. So it wasn't just, here's a number, call. Like when you go to the doctor, you get a referral. It's up to you to follow it. We couldn't do that with people because they couldn't do it. First of all, they didn't have any phones. They didn't have any, they didn't know how to get around, those kinds of things. So for us, the social determinants of health really was really about all of those things that you've learned, but in addition was about being there, being in the lives of people, getting to know people. And I always, moving forward to Mary Center, there's, we did a survey, and I think this goes for any profession that you go into, is getting to know whether it's what widget you're making, getting to know what that widget is, or getting to know that person, or getting to know like what people like so you can sell it or whatever. But for us, it's really, it was all the technology and all the stuff that you get at your doctors, and maybe you've been to a community health center before, but it was also by getting to know the individuals, right? And one way to do that, because we were maternal and child health, we were able to do those home visits, and home visitation really allowed us to really get to know their home, get to know their family, get to know which neighborhood they live in, so that if we could connect them, so we could connect people to their neighbors, right? So so that when they went into labor, they didn't go they would know what to do. So they would have someone that could help them and take them to the hospital. It was introducing them to the hospital, right? And so those little things I think were, but I think what we encountered were people who were saying, you're trying to do too much. And then when we said, because when then the children
Perhaps some people who were getting funded to do some of the things that you were
maybe the competition, right? Maybe the competition. But I think then when the mothers said to us, well, okay, you helped us with during pregnancy, but now where do we take the baby for care? And it was like, okay, trying to find where to do that. And so every single program that Mary Center started was really done because we listened to what the clients and the participants, whatever you want to call them, we didn't really call them patients, but participants, listen to them and see what they needed. And so, the pediatric unit was started because people were like, we've been trying to find a pediatrician, but we don't have insurance. So, no pediatrician wants to take us. And the public health clinics, that the DC Public Health Clinic didn't have anybody who spoke the language. And then we started to get, as we get in more conflicts in this world, and the U.S. Gets into more, well, not gets into, but as we and the world gets into conflicts, then we started to get more and more people from all over the world, right? So it wasn't just Spanish; it was all kinds of other languages, and so see where do I want to go? So
it's okay.
So I think let me leave it at that.
Well, because I was going to say, well, last question before I turn it over to our students is, you've got a vision. It's incredible. I think it resonates. I mean, I think it's fair to say you are way ahead of your time in terms of the vision of what we think about in terms of care. But here, let me ask you a different question about you, though. So that, as I remember, the original Mary Center, it was a small sort of basement operation in Adams Morgan. It moved to a slightly bigger location. But by the time you retired, you were serving, 60,000 people a year? 80,000. Yeah. So you were a CEO, one of the largest health provider networks in our city. Mm-hmm. So that's a long way from being a 13-year-old in Columbia, a long way from being a nurse in a hospital here, or even a founder of a community program. How did you grow into that mode?
Yeah.
And it's a different role. It's a much bigger organization.
Yeah, it's much bigger. Being like I said, I got really confined in a hospital setting, and that's why I had to leave and get out and go into the community. I think for me, and I leave you with this because I think if you remember nothing else tonight, I think it is that always surround yourself with people that are smarter than you, right? And that know and that are creative, and that people that, don't be threatened by people that are smarter than you. Don't be threatened by people that have more degrees than you. Don't be threatened by, those kinds of things that make you feel inferior. The opposite, I think, the more you surround with people that know more than you, that make you question how much more you should learn and how much more you should do, that's good for you. It should make you feel empowered. And I think that's what fueled me at the center for 30 years. And so how many people stay for 30 years in the same job, right? Some of your parents might, but nobody ever does that anymore. But what fueled me was really, it's really people like yourselves, right? I have people like yourselves, like, would come into the center to be family support workers or to work the front desk or whatever. And they always had amazing ideas. They always were inspired, of course, by me and by the people that worked there and by the services that were provided. But what they don't know, and what I probably did not tell them enough, is that they inspire me because they were full of energy. They were full of ideas, some of which were so easy to pick and implement, right? How to put the front desk in a certain way so that it's much more easier for people to get through, right? Something as simple as that, as how to get people into the health center much quicker and be able to see people and more people, which is a lot more difficult in terms of the services. But I think that is one thing, is surrounding yourself with people who know more. The other is really really working hard at making sure that that you bring people that that look like the services that you provide, right? So people in marketing are really good at this, right? They actually, you know, solicit, you know, people, if they want to sell a widget, they want to make sure that people who are using that widget are there beside them, telling them how to do it and when to do it and how many to do, right? And so I think the same thing in the workforce is really, you know, making sure that you surround with people that look like the people that you're serving, because I think that also fuels a lot of energy and fuels a lot of trust, right, in the community, because they see the faces that are coming in. At the end of my tenure, the last 10 years, you know, we were challenged with the idea that the model of Merit Center is an amazing model, and it has again, you read about it, and it's not just healthcare, but it's education and social services. And we have the Merit Center has a research program that you know, that actually addresses, you know, Merit Center gets to decide what research gets done in the community, and what research gets done with their data, as opposed to, you know, in cases where universities say, we want to do research, can we borrow your stuff? Merit Center is trying to change that model. Still help universities, because we want to make sure that you're the next generation of researchers, right? But change the model a little bit about who is in power, right? And so I think that I think is another thing. And if I can encourage you, all of you, because all of you are doing global health and global things, right? And some of you may never do it overseas, but global in the United States will always be, you'll always be able to do it in the United States if you want to. And I think it's learning a language, but along with learning another language is learning their culture, right? Learning how people behave, how they live, what customs they have, what's dear to them. You know, I was speaking to an Iraqi refugee the other day, and she was telling me that when they moved, when they became refugees here in the States in 2006, she said, you know, Maria, I was born pretty much, well, like, no, I can't even compare. But anyway, she was born in an era where her entire life, her country was at war in Iraq. The whole time she was at war. And so when she came to the States and somebody said to her, like the first week she was here, they said, okay, what are your plans? What plans do you have? And she burst out laughing and crying at the same time, because in her culture, in the times that she was living there, nobody planned anything except to flee if there was danger. Like their plan was, how do we get out of here when the bad guys come and want to kill us, right? There was no other plan. So learning that has a lot to do with how people learn, and what people, how people, you know, people say, well, you know, some of these people that come here, they have no visions, that there's no plan, there's no plan, because their lives weren't that way, right? There were no plans, that there were no time to have a plan. They're either working, and again, the plan was how to escape. So I think the other thing is learning a language. And then I think the other is that that really, I think, helped me and fueled me was just honoring where you come from. And it doesn't matter where you come from, whether you're white, black, you know, poor, very well-to-do, moderately well-to-do, but honor that and take joy in that. And I know some of you, and John and I were just talking about when we were younger, sometimes we don't appreciate our parents, right? But you will. To me to say you will. But I think honoring where you come from, and then using that sort of as your trampoline for other things that you do in life, right? And I think there's, if you can take a moment and think about the things that your parents have taught you, the things that you have seen your parents do in life, the struggles and the successes and the joys that your families have brought you, and maybe the the not so joyful days that your family has not brought you, think about that and think about how you want to do it differently, and then draw joy from that, and do it differently if you need to. So that's for me what has driven me.
It's a perfect transition. So I'm going to ask. So Maddie, do you want to kick us off? I think you're supposed to. Do you have? Oh, I'm sorry. I didn't realize you. Oh, you guys can trade it off. Thank you. Sorry.
First of all, I just wanted to thank you for coming. I'm very inspired by your discussion. One thing I really took from what you said was like the importance of education in healthcare. So I was interested because in our reading, I read about like the education programs within Mary Center. So I was wondering, like, what were the lessons you learned from teaching other people, and did that change the structure of the Mary Center programs?
Mm-hmm. Yeah, thank you. That was actually, I saw that question. Hearing this question to me was very insightful, because that is one thing that all these years I learn more than I give. I know I learn, and the thing is to incorporate those learnings into my life. I think has been very important. But I think your question is, what did I learn from teaching, right? I guess is the question. And I'll just give you an example. When we were starting Mary Center, we had the initial maternal and child health, and then we did like about I think we were in the almost 10th year of our existence, or even less. I think maybe 8 years. We did a survey of what was what the community needed. So it was a community survey to kind of tailor our services and what would be needing next. Because so many of the programs that we initiated in the beginning were based out of the staff. And this is why I say to you, when you're in the workforce out there working full time, don't underestimate yourself. Don't think that just because your boss is 60 years old that they know it all, because we don't. We need to be fueled by you. So I think for me was just really learning with an example that to me was really important. The survey, we asked them what are some other health needs that you at this point need met, that Mary Center can assist with. And oh my gosh, survey after survey after survey after survey was we want Mary Center to help us make sure that our children can go to college. And I was like, okay, that's not in our agenda, but okay. And then survey after survey was like, and we want to make sure that you give us places to eat. You give us, make sure that we sign up for food stamps and sign up for all these things that relate to food, because food is how we're going to cure diabetes and hypertension, all that. And yet our teeth are rotten and we can't afford to go to a dentist. So can Mary Center start a dental program? And it was like, okay, two things that are way out of our league. That's just not in our cards that early on. But we saw that survey and we said, we talked to the federal government, we talked to the local government, and we said, here's what we need to do. And so we were able to start looking at, okay, couldn't start a dental clinic right away. That took several more years. But what we could start was training pediatricians how to assess for cavities in a person's mouth, right? You don't have to be a dentist to assess that. But the pediatrician who was doing the survey, that was part of her fellowship, she was like, I don't know diddly squat about dental care. Why are we even thinking and talking about doing this? And so I said, because you can learn it. Because we talked to dentists, and the dentist said, oh my goodness, we would love for pediatricians to be able to one, do the teaching from prenatal care, and once the baby's born, and then emphasize to families, how important dental care is. And so we started with that. And after a while, of course, that mushroomed into like, of course we have to have a dental program, and the dental program is one of our biggest programs now. And the same thing with education, right? So we had a teen program way from the beginning, because a lot of our clients in the beginning were teens. A lot of the teens were the ones that migrated here. But the teen program is more about really like how to make sure that teens, didn't get pregnant, making sure that teens, graduated from high school, or even getting them into high school because they didn't know English, just basic stuff, right? But what really allowed us to think was farther, like where do we start? Do we start upstream or do we start downstream, right? And for us, it was really important to start early, and that's why we partnered with an agency that was called I forget what they're called now, but their name is Bria now. Funny, I can't remember the name, but they needed an organization that was bigger than them, and we said, oh my gosh, this is a perfect partnership to comply with the survey that the community wants. And it was an organization that was actually doing early childhood. So right after the baby's born, how to deal with early childhood, how to teach parents how to take care of their children, but also how to select a better child health center, child education center for their child, and how to begin to sort of in their minds, parents to make sure that education was possible in this country. And also teaching, because so many of the people that were coming from all over the world, a lot of these countries don't have, it's not mandated that kids go to school after a certain age, right? Some schools, 3rd grade, some schools never. Some countries never. So, just teaching people that it's mandatory. If the child has to go to at least 1st grade. If not, we can get them in early into kindergarten. And so all those so that's how the program started with that. So I think, to answer your question, it was really truly listening to people was very, very important, and always understanding that that anything is possible, and you just and it may take years, and it may take beyond the time that you want to spend on, but somebody else will pick it up and make it happen if you have to move on. But never think that anything is impossible, right? Just think about slavery in this country, right? Think of all the things that have happened in this country that were here, that have transcended because people had a different vision, right? So,
Madeline, do you want?
Thank you again for speaking to us. One of the things that stuck out to me was when you mentioned you started Mary Center in the 1980s due to the influx of migrants from Central America. And you said that it was very similar to the situation today with immigrants. And so I wrote this down quickly. In the past 40 years, how do you think healthcare services for immigrants have changed? Have you seen a shift where other centers are reproducing Mary Centers championed all these years? Or has the progress been a bit slower than you'd like to see? Are you optimistic for the future of healthcare in this country and elsewhere for immigrants?
Yeah, thank you for that. I think that I would just say the first thing is if we can invest so many of the dollars that we put out there in the community, if we can invest those dollars to make sure that those countries that people are coming from are strong, and that people can be in their own culture. Not that we don't want them here, of course we do, but I think any immigrant that comes to this country would say to you that if they had the opportunities that they can have here for their children and for themselves, they would rather have them at home, right? They would rather be at home in their own culture. So I would say that that's one thing that I would just say to whoever's listening in the federal government. If we can invest more dollars into those countries, would be for people to have strong education, strong housing, strong, but particularly education, right? And safety is important. I guess for me, I am very optimistic, and I tell you, when I first started healthcare, Mary Center, when we started Mary Center, and prior to Mary Center, if you weren't born in this country, you really, and you couldn't afford private health insurance, you had nothing. Like you had nothing. If you ended up with an appendicitis, or you were pregnant, or you were in a car accident, you were at the mercy of whatever hospital would take you, because in those days, hospitals didn't have to take you. It's like right now, somebody ends up at Georgetown has to take that patient, right? In my days, I know, I know that has a two-edged sword, right?
Yeah.
But in my days, when we first started, hospitals could actually say, we can't take you and return you. So even if if you were pregnant and baby was coming, so I think I'm optimistic, because in this city we fought very hard, and I was part of that group of people that fought very hard to get what is now called the DC Healthcare Alliance. Some of you might have heard, and that was very much like the Affordable Care Act, in the sense that it allowed immigrants who could not qualify for Medicaid, because Medicaid is the public insurance, right? Like Medicaid, Medicare. And so it does not allow for immigrants that are not documented in this country to be part of that system, which is, by the way, an amazing system. That as much as all the handicaps that it has, it is an amazing system. And anybody who tries to challenge it and say that we don't need it, Medicare and Medicaid saves lives every second, right now as we speak. But the DC Healthcare Alliance is really a lookalike, if I can say it. It mimics Medicaid, and so it mimics Medicaid for the undocumented, and so it allows them to go to the hospital, allows them to get primary care, and those kinds of things. And so because the Affordable Care Act was so wonderful, but it did not allow the undocumented to buy into it. So even if the undocumented person had money, they still can't buy into it right now. So, but I mean, that we lost that battle, but more and more states, not now, but in the past, more and more states were trying to bring up something that looks like that. And I think several states have it. In Minnesota, there's really good states that have that program. So I'm optimistic, because I think there are people who understand that hospitals alone are not going to be able to do it. I mean, I don't know if any of you have used the emergency room at Georgetown or Sibley or any of those hospitals. You could wait up to 10, 12, 20 hours in the emergency room if it's not an emergency, if you're not dying, because they're booked to the scene. I mean, a lot of those emergencies that are coming in there are emergencies, but a lot of them are not. A lot of them are because, and some of the emergencies ended up being emergencies because people did not get the primary care, the care that they needed to get early on, and so they ended up in the emergency room. Some is that I don't think we've invested enough in primary care. So even if we have so many women that are am I allowed to say this in this institution?
Yes,
okay, that have their second child or have that first child, an unwanted pregnancy, because the earliest family planning appointment they could get was 6 months later. So they were there. So that's just an example.
You can say anything you want here.
But even let's use something more simple as that, is less complicated than that, is the somebody who has a toothache, right, and didn't get it taken care of, it got infected, and now their whole systemic, they have infection in the whole system, and people have died from infected tooth. There's actually a whole case in Maryland, for that. The Monty Health Dental Clinic got started because there was a child who died because he was an African American kid who did not get, dental care because they couldn't get into a dental care clinic. So I think we need to invest more in primary care. I'm hopeful. I think also because I think that I'm inspired by so much by people like yourselves, who are young, who are sitting here with a 1 credit class that really, like, really 1 credit. But you know, but you're sitting here at no. I'm just saying. But I'm just saying that at this time at night, you're hungry, you're tired, you know, but you're sitting here because you want to make a difference. You want, and I'm inspired by that. And I hope that today you have heard some things that say to you, whether you're going to go into marketing, or you're going to go into healthcare, or you're going to go into whatever field you go, or you're going to become a lawyer or whatever, you know, think about just making sure that you're there, you're transparent, you're functioning from a place of just, right? That what you're doing is just. This is very important, and I know this institution teaches you a lot about that, because it taught me a lot. I hope it still continues to do that, but also just also questioning. You know, don't ever let anybody say, "Stop asking those questions. We can't do this. We can't do that. That's too lofty," because that's how this world has changed. It's through lofty ideas that people had. You know, and also just remember, like, you know, people in the business world have tremendous lofty ideas, and they take them off the ground, and many of them sink, right? And we support those with a lot of money. We support a lot of those ventures with a lot of money. And so we need to really support a lot of ventures in healthcare to make sure that is equitable for everyone in this country.
I love that vision of investing in innovation for low-income people.
Let me look at other questions. I'm not sure who's okay.
Did that answer your question?
Thank you.
Gabby, oh, please.
Yeah, so my question was about, you talked about how you started off kind of working in a hospital, like getting firsthand experience, and you said that was really important for the rest of your career. I was wondering kind of like, in what ways did that inform how you like led St. Mary's?
Right. So one was that I was in the midst of like this amazing group of people, right? Doctors and nurses and social workers and, oh my gosh, you name it, that were just, you know, one more extraordinary than another at Georgetown, right? And so that to me was very inspirational. In the back of my mind, I thought and toyed with the idea of going to medical school, but that was not in the cards because I just couldn't afford it. I couldn't afford to take the time off to do that. But in retrospect, it was wonderful, because I think if I had gone to medical school, there was no way that Mary Center would have ever been established, right? There was no time for that. But I think one was that I was, you know, immersed in this extraordinary group of people, great role models from nursing to doctors to social workers, and how to treat people, and also models of how not to, right? So I learned a lot in being in that setting, and how sometimes people were treated because doctors were too tired, nurses were too tired, you know, and people, the patients did not get the services in the way that they needed to get them, and with the attention that they needed to get them. And sometimes in those days, not so much now, but in those days, there was no family allowed in the room. Whenever we did a discharge, many times a discharge of a patient's families could not be in the room. And so because it was crowded, it was 2 in a room, sometimes 3 in a room. And so, you know, you discharge a patient who is like, you know, not feeling so good, and you're telling them to do this and take that medication and do the other and come back and blah, 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 and make sure you call your doctor. And they're like, and the families are like, what did they say to you? It's written in this piece of paper, you know? And a lot of times that piece of paper was written, because the old days, pencil, right? Which not too many of you have. Thank you. You couldn't read the writing. I 90% of the time I could not read people's writing, so much less the clients, so the patients. So anyway, but I think to answer your question, that was it. And I think what led me to get out was also the same, right? It was very constrictive for me. It was I took I took the orders off and I followed the orders, and you hope by the grace of God that the patients were able to follow the orders after they left the hospital, but many times they didn't because they came back. When I worked in neurosurgery, many people came back with when they had brain surgery because they didn't take care of what they were supposed to take care of. So I think for me that was I don't know if I answered your question, but I think it was both, right? It was staying long enough to learn and to really figure out what is it that I want. Do I really want to be in this very intense technology environment, or do I want to kind of like get out and explore more and learn more and be more innovative? So
excellent. I think who's next? Abby?
Okay, so you talked a lot about education throughout your whole discussion, and because I'm a nursing student, I'm sort of wondering, what are some things you hope to see as part of nursing education or just education in general at the undergraduate level? How are we going to make people have these careers like you did? How do we solve these problems? Are there certain experiences that you think people should be having a place like Mary Center so that they're aware of these issues and they can then solve them once they have their own careers?
Yeah, thank you. All those questions have been great. Thank you so much. I think that thank you for the what needs to be done differently, right, in education. I think one is that I'd leave you with also is just if you don't know, I know some of you probably know a second language because of your parents or because you were born there or whatever, but if you can learn a third language, that would be great. Some of you who only speak English, it's never too late. Like when you get to be my age, I'm trying to polish my French, and it's really hard, but it's harder as you get older. But so please, a second language is really, really important, in culture and travel. I mean, traveling is very, very, very important to, if you can have the opportunity to travel. And if you don't have the opportunity to travel, there are places even in town or in your hometown where you can go and volunteer, or you can go get a job in community health centers or just health centers that help the immigrant population, whatever it may be, through housing or education or whatever. So I think, to me, that's really important. So that's on one side. On the education side of nursing, I think nursing really, I think we still have in many ways there's the bells and whistles of being in a hospital setting, right? Because that's right now, I think, still in 2023. Like I know when I decided that I wanted to do community health nursing, people were like, great. It was kind of like the attitude that those are like what dumb people do, like the people who can't get the technology, the people who don't want to be in sort of the bells and whistles of healthcare. And but I think in that is absolutely necessary. Like I said before, absolutely. I mean, hallelujah, because if I'm going to have an operation, I want my nurse to know everything about everything that's happening. But I think that the schools really need to have somehow the curriculum has to be sort of redesigned so that people can have the experience of a variety of places that are not just hospital setting, and that community health and global health and those things aren't just a side-on, like an add-on that is an extra after you're tired of all the other stuff, after what is it, Dr. Angela after you're
believe it or not, Alan actually has retired.
Did he retire? Okay. No, but you know what I'm saying. That you bring education, that you sort of have those experiences as part of the education and not just something that you add on if you're interested. Because I think that's what happens is that if you don't get it in school, what you're getting in school is the bells and whistles, right? It's the hospital piece. And so so I think it needs to be redefined. I also feel like we need to really focus. You can always learn the technology, and the technology has become so mechanized, like it's like a cheat sheet, right? Like it's not like in the old days when you had to figure out like how much You had to actually know all your math and all that stuff that Alan used to teach us. Now it's just all, just look at your computer and you do it, right? Or it's already computerized in the machine. So I think it's more of like, you really need to be teaching at the schools more of the world nursing, right? Just because, I give you an example at Mary Center. This patient, they were asking the patients about, what did they like about Mary Center and what the services and all that. And I don't think I said this tonight, but anyway, this patient said, Mary Center has great programs. Everything is wonderful. And she was just very thankful of everything that we're doing and all that. She said, but there's one thing that I wish that Mary Center did more of. And I know it's done, but it's only when by individual providers, right? It's not something that's in the protocol of working with clients. I wish that the provider had asked me, who am I as a person? Who am I? Like, I'm not a diabetes patient. I'm not a hypertensive patient. I'm not a pregnant woman. I am Maria Gomez with a history, with ideas and joys and desires and traumas that affect how I take in the education that you're trying to give me, And so that person was saying to us very clearly, like, we need providers to understand me as a person. And when you understand me as a person, you'll understand how to provide the care that you need to provide to me much easier, Because if I tell you that right now my child is being, that is in jail and is being taken to, faraway place where I can only visit them, every so often, or my husband has just been, has had surgery and they gave him, so many days to live, and he's the wage earner, there's no way that I'm going to take your education. What you're trying to tell me today, I'm not even thinking about that, right? So I think that is, it's where I think when I talk about education, it's not so much the nursing education that you're providing the person, but the education that you're learning from that person about who they are, and also the education that if the opportunities, right? What are those people's desires? Like this woman from Iraq, right? Who when they asked her, what is your plan? She kind of laughed and she said, I don't have a plan, but if you're asking me what I want, she says, I want to be a dentist. I want to own my own home. And she is now a dentist with 2 practices in Virginia, and she's doing really well. And she owns a home, and she's got her kids, and everything is great. But she had a dream, and the person who was caring for her in that refugee home understood all of that and gave her the time to be able to study so that she could, they took the kids to daycare, the husband worked, and the woman, this woman who's now a dentist, stayed home and studied so that she could take the TOEFL test, the English test, so that she could go to dental school. And so she's now a dentist. But does that help? Yeah. Yeah.
Excellent. Please.
I'm just wondering, how do you think that the recent overturning of Roe versus Wade impacts pregnant and future to be pregnant immigrants in the country, and also centers like like your center?
Yeah, very much so. And I think, it just not only immigrants, but everybody, right? I think, I think that overturn, I think, goes deeper than somebody just not being able to have an abortion. Okay, but that's so. Put that aside. What it really does is stifles. Is that the word? The ability for women and for families, right, to be able to get their dreams, right? to really, like I said to the Iraqi woman, in so many examples, 30 years of examples of one family after another, that could plan their families, that could plan their lives. That's one thing. The other is just, I think it does, and we see it. I've talked to families right now who know that I worked at Mary Center and are asking me for help. Is that it imposes a lot of stress on a family, unnecessary stress. And how do people take out the stress, right? Males who are trying to really work, and the fathers who are or the partners who are trying to really work hard, are now with, oh gosh, another mouth to feed, right? Not that they don't want that child, and not that, but it's causing a lot of domestic violence. It is. I have 3 cases right now. People like, what can I do? He's hit me now 3 times, and he's hit me in my stomach 3 times now, and and he's threatening to walk out because he just doesn't want to deal with another child. And so I think that people don't understand the repercussions of that, right? And I think the whole idea of family planning. I think it's putting abortion aside. The whole idea of family planning is being also challenged, right? So it goes beyond that. It does not allow some women to continue their studies. This one particular family that I'm helping right now is also their children are seeing all of this, right? And this is there's probably some of us in this table that have been affected by that kind of trauma. And so you read about it, and you've seen it, and you hear about it, and it's not good for children. It goes beyond your own family. It transcends generations, right? And I think that that's what we're doing with this. So,
please, Lena.
Thank you so much. I believe you had mentioned before the 1980s that you were dealing with the influx of immigrants, and now in 2023 you're kind of seeing that 180 of dealing with that. So I wanted to ask, in the recent political and social changes to the U.S., how has the Mary Center kind of worked to address and continue to work with different needs of the community as they change, and what kind of advice do you have to students who want to serve refugee and immigrant communities, especially in a challenging landscape that we often face here in the U.S.?
Yeah, that's I say 180 because I think it's just the same thing. The reason we started Mary Center is because there was all these refugees. Call them immigrants. At that time they weren't refugees, but immigrants coming in, and we needed to do something, right? I think that there's so many ways that young people like yourselves can help, and I think one of them is around when the buses were coming. I don't know if some of you were able to get involved in that or not, but there were a lot of agencies here. There's a place called Mary House, which is actually a not Mary Center, but Mary House is a shelter, and it's a housing. It's a long-term housing for refugees and immigrants. And they always need help in terms of they have a food bank there, they have a school also, they have housing there, and they take on refugees from all over the world. So volunteering in agencies like that at Mary Center, I don't know what your plans are for after school, after you graduate, but even while you're still here in school, there's opportunities for you to help in the social service department, in just helping people navigate the whole healthcare system, right? Some of you, if I'm sure, have had trouble navigating your own healthcare. Imagine if somebody who doesn't speak English, or somebody who even speaks English but may not have insurance, or may have insurance and speaks English but has a major problem, a major health problem that they can't get around as easily. So there's those opportunities. And I also feel like there's Georgetown has several programs that I think they do in the community with kids. And if you're interested in the whole refugee or immigrant population, there's so much that can also be done in the African American community. There's so much opportunities, especially around the tutoring, around just helping families. Like there's so many programs in the city, particularly where you can take kids to the zoo and take them to different places so that their parents can have some respite time, or their parents can go to a class or whatever. So there's all kinds of opportunities for that. And I would just say that I'm a little discouraged right now with what's happening, really, with the immigration piece, right? And I wish that I could say that I'm discouraged and I have a solution, but I don't have a solution. So I can't really sit here and complain, because we also have to figure out how to deal with this whole border thing, right? It's not easy for the government with this many people coming in. It's not easy for people that are coming in because their countries are a disaster. It's hard to see that only certain countries are selected, and why those countries are selected to help more than others. But I understand, because politics is politics. But I think that what I'm disillusioned is that all these years we haven't been able to find a solution, and with some great minds. I mean, we have this organization. I have the thing here. I don't know if you guys know, Keeping Kids Safe. Kind. It's like the Kind bar, but it's keeping kids safe. It's a great organization. They do some great work. That we haven't been able to figure out an immigration path that is not sort of based on who's in power, right?
Yep.
And how do we? And this is what, and maybe this is not a good way to finish this conversation, but how do we figure out, literally over the weekend, how do we figure out how to salvage and how to get people the money that they need to get from this banks that have gone under? How do we figure out how to get that money overnight to every single one of those people? And we can't figure out something like this, right? And we can't figure out how to stop hunger, and we can't figure out how to get everybody health care in this country. So again, I'm not here to squash any administration. I'm just here to say, why can't we put our minds together to solve issues that would allow more people like yourselves to become engaged in issues like this, and not be broken down because they're hungry and because they don't have good health care, right? So
I think that actually is exactly where we should end our conversation, because that is the charge to you going forward. I wish, I've worked on this immigration policy issues for the last 30 some odd years. It is very, very hard. It will really require people listening and learning and finding different ways to go forward that we have not emerged yet. And it will only emerge when people act and think and advocate differently. I mean, that is the challenge. The world you're getting is not an easy one, but it's one that needs its attention. Just one thought, just in reference to your point about opportunities for students, just in case anyone doesn't know, the Center for Social Justice here, especially for those of you who are first-year students, really is an amazing resource for volunteer opportunities of all kinds, including places like Mary's Center, but a wide range of activities here in our city. So I would urge you, if you have not checked that out and you have an interest in doing community work, it's a really terrific resource.
Yeah. I also
Any
wanted to
final
just
word,
say,
please?
I just wanted to say that I gave her. I have nobody's giving me any money for this. I don't even know the author at all, but it's called Solito.
But I got a free book.
You got a free book. It's called Solito, and Solito means by yourself in Spanish. It is the journey of a young man like your age, who traveled the border by himself. And his whole journey is really an easy read, but it could be anybody from any country who has to leave their country because of war and tragedy. It's really, really an excellent book. It's called Solito, and he now is a great poet and an amazing man in giving back to community. And so I would just amazing person, I should say. I'm so sorry.
Well, let me ask everyone for a round of applause for yet another amazing person. Thank you for your service. You distinguished Georgetown in many, many ways. And so we are honored to have you as an alum and thankful to you for your time today.
Oh, no problem. So, and if anybody wants to get in contact with me and wants to have a chat afterwards or another time, I'll just put my cards right here if you want them. I don't have personal cards. I'm doing a little consulting with a foundation. So it's the foundation's cards, but it has my information here. Okay. So if you want. Okay.
Thank you.
Thank you so much.